Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on one of the important topics related to women, that is white discharge, or it is also known as leukorrhea. So there is a common misconception that leukorrhea is a disease. Basically, it is not a disease. There are two forms of leukorrhea. Leukorrhea is a symptom. So basically there are two forms of leukorrhea. One is a pathological form where you have certain diseases, especially vaginitis, then you get leukorrhea, or sometimes it is physiological. Physiolocal in some of the conditions, it is absolutely normal. We will differentiate what is pathological, what is leukorrhea, how to differentiate, and look into the leukorrhea which is normal, which is physiological. And also we will decode some of the myths. There are a lot of myths around leukorrhea. We will look deeply into it. This is especially for women who want to know more about leukorrhea, whether it is normal, abnormal, how to differentiate between normal leukorrhea, abnormal leukorrhea, and how to decode some of the misconceptions you have around leukorrhea. In order to understand leukorrhea, you need to understand some anatomy and physiology. Anatomy means normal structure and function of female organs from the perspective of leukorrhea. Basically, female will have labia majora, labia minora. These are the two structures. Between two labia minora, there will be a flat structure, that is vestibule. In vestibule, in the upper part, they will have clitoris, and just below the clitoris there will be urethral opening. Just below the urethral opening there is vaginal opening. On either side of vaginal opening there will be small opening, that is Bartholin glands, and the drugs opening from the Bartholin glands or Bartholin ducts. These are present on either side of vagina. Once you enter into vaginal orifice, there will be vagina, and connecting vagina and above uterus you will have cervix. Uterus then leads into two fallopian tubules. This fallopian tubules leads into fimbriae. At the end of fimbriae, you will have ovaries. This is the structure of female genitalia. And coming to the important histological feature you have to understand here is, in the vagina and cervix area, there are a lot of glands. Those are called vaginal glands. The main function of this vaginal glands is to secrete some mucus, that is vaginal fluid. And coming to the physiology of vagina, vagina is the organ where there will be sexual intercourse and ejaculation of sperm into it. Here you have the vaginal glands. These vaginal glands will secrete mucus. This is known as vaginal fluid. In the vagina of the female, along with this vaginal fluid, there are some other organisms. Those are bacteria, fungus, and protozoals. These are present in vagina of the women. These stay there as a commensal. Commensal is the association between two animals where there is no use and also no harm. For example, here the two animals are, first animal is human being and other animals are either bacteria, protozoa, or fungus. These come together and live in the vagina of the female, but there is no use or there is no harm. They live side by side, but there is no use or no harm in that association. This we call as commensalism. These are the some bacteria, fungus, and protozoans live as commensals in the vagina of the female. These are all common. This vaginal gland secretes fluid, that is vaginal fluid. This vaginal fluid varies from women to women and also on her stage or what stage of her menstrual cycle she is. This will change. Every woman has distinct amount of vaginal fluid secreted per day. The consistency or the color or the odor of this fluid is different from women to women. Normally this is clear, relatively odorless and whitish color fluid, and the pH is slightly acidic. This is about 3.8 to 4.5 of pH. And also there are some bacteria, that is lactobacillus. Lactobacillus normally lives in gut intestine of a human being, but even in the vagina of the women there is some lactobacillus present as a commensal. What are the uses of this vaginal fluid? This vaginal fluid helps in keeping the vagina clean. That is the first one. It keeps the vagina moist always, and also during sexual intercourse it acts as a lubricant. It prevents the infection of vagina, and also it prevents the accumulation of dirt in the vagina of the women. It also helps in balancing the pH so that the sperm released into vagina will stay alive. It swims through cervix and reaches the fallopian tubule to fertilize. These are the functions of vaginal fluid. And coming to the menstrual period, there is a relationship between menstrual period and the amount of vaginal fluid coming out, and also the thickness of vaginal fluid, color of vaginal fluid depends on the menstrual cycle. So consider a woman is having a regular menstrual cycle, typical menstrual cycle, that is 28-day menstrual cycle, and here immediately after the menses is completed, menstrual flow is completed, the amount of vaginal fluid coming out of the women's vagina is medium in quantity. It is whitish in color and it is thick. It is not too small or too low quantity or too high quantity. As the women move towards the ovulation period around 14 days, the consistency becomes thin, it becomes viscous, it becomes thin, it becomes like egg white, and the amount of vaginal fluid coming out is also increased. There will be a lot of fluid coming out. It will be transparent here around 14 days during ovulation. This is because when the sperm is deposited into female vagina, it has to swim through the cervix and it has to reach the uterus and fallopian tubules so that it can fertilize. The importance of becoming like liquid or egg white, the sperm can swim easily and helps in fertilization. As a woman move towards the end of the menstrual cycle or just before menses, the amount of fluid coming from the vagina becomes low. It is very small, it becomes thick, it becomes curdy, and it becomes cheesy. This is all normal. In some women, the average amount of vaginal fluid coming out of a woman's vagina is around 1 teaspoonful. In some of the women, it might go up to 30 teaspoons, huge quantity. So that woman has to use a pad. This is all normal. This is nothing abnormal in it. Some women feel that this is abnormal, but this is completely normal. And what are the other physiological conditions where women has excessive vaginal discharge? First one is menarche. When the girls are about to mature, they will have lot of vaginal fluid coming out. This is all normal. There is nothing abnormal in it. And coming to the next physiological process, during when the woman is sexually excited, she will have lot of vaginal discharge. This is also normal. And also during intercourse, immediately after the intercourse or during the intercourse, women will have lot of vaginal secretions. This is also absolutely normal. There is nothing wrong in it. And also during pregnancy, when the woman is pregnant, there is a lot of vaginal fluid coming out. This is also physiological. This is not abnormal. But what women thinks is when there is excessive discharge of vaginal fluid, she thinks this is abnormal. When the vaginal discharge is excess, when you are in the middle of the menstrual cycle or when you are about to mature, or when you are having sexual intercourse or immediately after the sexual intercourse, and also during pregnancy, these are all normal and no need to worry about this. Some women have 1 teaspoonful of vaginal fluid coming up every day. Some women have 30 teaspoons. It is normal for them as well. And there are some myths around vaginal fluid or white discharge. Women think that this vaginal discharge is responsible for backache. When you have excessive vaginal discharge, she thinks that this may lead into backache. This is not true. If you have any other pathology along with this white discharge, then only you will have backache. Otherwise, if you will not have backache, this is just a myth. The next myth is weakness. Women think that when there is excessive vaginal discharge, this causes weakness in her or it may lead to premature death. This is also a myth. This is not true. So there is no relation between you being weak or excessive vaginal discharge coming out. There is no relationship. And this is also completely myth. You can just ignore this. Next one is bleaching of panty. Some women think that when their panty color changes, when the vaginal fluid falls in their panty, they think that it is abnormal and they think that there is some cancer or something going in her body. This is also wrong because the pH of normal vaginal fluid is around 3.8 to 4.5 pH. So this is slightly acidic. That's the reason it has some bleaching effect on the panty. It is completely normal. There is no abnormality in it. And also next one is, so normally this vaginal fluid increases after the sexual intercourse. In some women, what happens is when there is sexual intercourse is completed, vagina discharges excessive amount of vaginal fluid and the vaginal fluid comes out of vagina. She thinks that the sperm has come out and she is not able to conceive because there is no sperm inside her vagina. All the sperm has come out. This is also absolutely normal. There is nothing abnormal in it. When you have excessive discharge of vaginal fluid after sexual intercourse, rather it is good for fertilization. The sperm can easily swim into uterus and fallopian tubules so that it can be fertilized. Basically, this is a positive sign. This is not a negative sign. These are all the myths around leukorrhea or vaginal fluid. And coming to the abnormal vaginal fluid or leukorrhea, if you have these signs and symptoms, then you can consider it as abnormal vaginal fluid. There are many reasons for abnormal vaginal fluid. The first one is viral infection may cause abnormal vaginal fluid or vaginitis, some bacterial infection or protozoal infection, and also some chemical irritants and mechanical irritants may lead to abnormal vaginal fluid. Some of the cancers will lead to abnormal vaginal fluid, and also in postmenopausal women, some women will have abnormal vaginal fluid. So when you have symptoms like the vaginal fluid is very thick or grayish in color, yellow in color, or or greenish in color or white in color, and also if it is producing some smell, rotting smell or meat rotting smell or fishy smell, then also you can consider it as abnormal vaginal fluid. And if you have excessive itching or irritation on your private parts, or also when you have redness or blisters around your private parts, and also soreness or tenderness around your private parts, you can consider this as abnormal vaginal fluid. Sometimes excessive vaginal fluid is associated with burning and also with or without fever. These are all pathological conditions. Then you have to approach the doctor. Some women also feel pain while urinating. This is also abnormal. Then you have to reach out to the doctor. If you have bleeding between the periods along with the vaginal discharge, and if you have streaks of blood or brownish vaginal discharge, then you have to consider it as abnormal. And also when you have dyspareunia along with vaginal discharge, dyspareunia means if you have painful intercourse, if there is pain in your vagina just before the intercourse, during the intercourse, and after the intercourse, you have to consider this as abnormal and seek out to the doctor immediately. So basically this video helps you in understanding what is normal vaginal discharge and abnormal vaginal discharge, what are the causes for abnormal vaginal discharge. When you have abnormal vaginal discharge, you are supposed to reach to us and take the treatment immediately. We are Fidicus Homeopathy. We are located in Manikonda, Hyderabad. We offer you two types of treatment. One is online treatment and one is in-person treatment. Online treatment means we will take your case in phone, or it can be either a video call or audio call, and you can share us the reports. We will send the medicines to your doorsteps. You can use and get this disease cured, or else you can directly come to your nearest branch and meet us personally and take the treatment. Thank you.